Do you understand which fertility hormone panel you need to get checked when you ask your doctor for blood tests? No? Well, nor do a lot of people, and actually, and quite often, nor do your GPs, unfortunately. So, as a practitioner of Chinese herbal medicine and acupuncture, we advocate for women to know exactly which blood tests that they need. Now, there are a list of hormones that absolutely you should be getting checked. And if your doctor will not give you those, then pay privately. I can't urge this enough. So the basic standard blood tests that are being done are simply not comprehensive enough. And if you are struggling to conceive, if you are having problems with period problems, if you are having implantation issues, if you have recurrent miscarriage, these are the absolute basic blood panel that you need to ask for. This doesn't mean that this is the only ones you might need, because actually if there's things that show up in it, then we need to do more testing. So I'm going to list those now for you. So what I have here are the two forms that I give my male and female patients, because if you're male, this is just as important. You might have millions of sperm, but there also might be a problem with them. It doesn't mean that they're okay just because you've got loads of them. So we're going to talk about the women's ones first, and I have my cheat sheet list, and this is what I give to all my clients who work with me. And just if you don't know, I'm Nicola Court. I am a traditional acupuncturist, herbalist, and I specialise in women's health, gynecology and fertility. So your female hormone panel, and I will list this in the link later. You need luteinizing hormone, you need follicular stimulating hormone. These need to be done on day 2 or 3 of your cycle. No other time. No discussion, day 2 or 3 of your cycle. And that is day 1 is the first day of your bleed, day 2, day 3, day 4, okay? Then you've got estrogen. You then need to have your TSH. This is your thyroid panel. TSH need done. We're then asking for free T3 and free T4. That's free, not 3, okay? So that tells us an awful lot what's going on with your immune system. We also want thyroid peroxidase antibodies. We want thyroglobulin antibodies. We're then going to ask for AMH. Now, AMH, please remember, I've talked about this many times before. This is not an indication of how fertile you are, how long you've got left in your fertility journey. It's simply a number that tells you how many eggs can be recruited in that cycle. Okay, so a low AMH does not mean that you are at the end of your journey. It's completely nonsense. So AMH is a number we do want to see, but it is not the be all and end all of everything. We're then going to want progesterone. This is the thing that riles me the most, that progesterone needs to be done 7 days after ovulation. Now, many women go and have a day 21 progesterone test, but if you do not ovulate smack bang on day 14, which actually most women don't, then that progesterone test is invalid. In my opinion, my professional opinion, you need to go and get it done again. So if you ovulate, like many women do, day 10, day 11, that day 21 test is irrelevant. If you ovulate on day 17, day 18, day 19, day 20, what good is a day 21 test going to do for you? So you have to monitor your cycles, and this is stuff that I talk about with women who work with me. Cycle monitoring. So progesterone, 7 days after ovulation. We're then going to want prolactin. We want sex hormone binding globulin, otherwise known as SHBG. We want free androgen index, FAI. And then we also want to look at urea and mycoplasma. This is low-level infections that can be very deep in the body. We need to rule those out, because guess what they can cause? Miscarriage or implantation issues. So these are the basics. We also want to ask for an ultrasound of your ovaries, just to make sure you don't have PCOS. Or if you have PCOS, we already know that. Okay, so now we move to the men's test. Similar blood panel, FSH, LH, progesterone, prolactin, testosterone, SHBG, sex hormone binding globulin. We also want an STD screen. Now, you might have been with your partner for a very, very long time, and I am not saying that they've been unfaithful. on either side. However, if you've been sexually active before you met your current partner, you potentially might have contracted something that you are not symptomatic for. And with men, that can then affect the sperm. So it's really important to rule it out and make sure there's nothing from your past coming through to this current situation that you're in now. So we also, with men, we want to check, did you get kicked in the balls when you were a kid? Because that might be impacting on your semen. Have you had mumps? That's a massive red flag for men with women who have implantation, fertility issues. We also want to see if they've had any surgery. Have they got varicose veins on their testicles? Yes, you get varicose veins on your balls. So we need to get that checked. We need to make sure that there is nothing going on with your balls, okay? We don't actually check them. We send you to a professional who actually will deal with that. But you can check your own. The other things we want to ask for, full blood count. So we want to check liver function. We want to check fasting homocysteine. Vitamin D levels for male and female, really important. Iron levels, also very important. The full blood panel for the women is kind of just, that goes without saying. We want to check with men, selenium, very important mineral for men's semen health. Copper levels and serum zinc levels. We can also actually ask for a testicular ultrasound if we are not sure whether there is damage to the testicles. So we also want to ask about how much gluten you eat, how much bread you eat. We want to check if with men, we might go down DNA fragmentation because actually the semen can be damaged, which then can cause implantation and miscarriage. So these are the cheat sheets that I give to my clients who work with me one-to-one. If you're interested in that and you're in the UK, then reach out to me. We can arrange a discovery call. But my name's Nicola Court. I'm a fertility acupuncture specialist, practitioner, and I'm based in the UK. If you like this content, then hit subscribe for more really handy tips and tricks to help with your fertility journey. And I look forward to seeing you soon.